One of the programs here? Okay. So you're used to this thing.
So welcome. We don't want to miss one moment with our special guest, Dr. Sam Myers. My name is Teddy Potter. I'm faculty here at the School of Nursing, where I coordinate the Doctor of Nursing Practice in Health Innovation and Leadership. And I'm also Director of Inclusivity and Diversity for the School of Nursing. I'm very involved in a group that I want to shout out. A lot of them are here, the health professionals for a healthy climate. Our students are also very engaged. So welcome students, welcome staff, welcome faculty, welcome Dr. Myers. I do want you to know that we are transitioning. If you're not from Minnesota, we're transitioning seasons. We don't have our air conditioning on yet, and the buildings have not quite adjusted to it being spring instead of winter. So feel free to take off your suit coats. Now's not the time to be proper with a jacket on if it gets a little toasty in here. So welcome. I know that we've got people from California. We're glad you're here, and a lot of exciting people. Dom is in the School of Vet Med, so a shout out to all our interprofessional partners, because it's linking arms that is going to bring us forward. So Dean Mulaney, I'd like to welcome you to...
Excuse me a second. Thank you, Teddy, and to echo Teddy's comments, we're absolutely delighted, Dr. Myers, for you being able to be with us in this morning-to-morning conversation this morning. And as always, we boldly celebrate our interprofessionality. I'm going to step back, Teddy, just a second. So for the last couple years, we've been deeply engaged internally in fostering our awareness and our commitment to planetary health. And two concrete examples of us making that come alive is that we have a team in the school that is focusing on planetary health and how we actually permeate curricular research, etc., in the school related to planetary health. We became a member of the Planetary Health Alliance. We're still working on our exact precise plan to submit to that. And third, one that I'm most interested in is that the school adopted planetary health as the major inclusive component for our whole research trajectory of the school. So that is one way that we can share with you our sincerity in, frankly, our survival for all humanity as well as our Earth. And our school is committed. We're looking forward to this conversation. I know, Sam, you're going to share a few comments and then welcome a robust discussion. Welcome to the school and welcome to our guest, Teddy.
So Dr. Myers, we are so grateful to have you here. We'll let you do a little bit more of your own introduction on whatever you wish to share. But he's here as part of the ICOMOS conference, which is a major international conference on one medicine, one science, bringing together the animal experts, the plant experts, the land experts, and the human health experts all in the same room, engaging with science that's intersecting. So it's a very exciting time to be a researcher, very exciting time to be a healthcare provider, because we're starting to finally understand that the health of the earth and planetary health is the launching pad for what we do. So welcome to the School of Nursing.
All right, well, thank you very much, and it's really wonderful to be here with you all in what I just learned is the oldest nursing school in the world, and in particular to be amongst a community that's so clearly recognized at a structural level the need to work together across schools and disciplines and to restructure how we do what we do. Both the previous speakers had sober notes in their lovely and late introductions about where we are and the need to understand these issues in order to survive, I think was the word that I heard. And I think it's true that we are, let me see if we've got our slides here from the beginning. I think it's true that we are at really an extraordinary moment in human history, maybe a unique moment, and that we're only just starting to really understand its significance. For most of the history of human civilization, we've been in this period, this geological epoch called the Holocene, right, which was characterized by exceptionally stable biophysical conditions. But around the same time that our Apollo astronauts were bringing home these first images of Earth from space, we were entering a new geological epoch, the Anthropocene, in which human activity had become the dominant force determining the biophysical conditions around the planet. And our activities are now disrupting and transforming our natural systems at much, much steeper rates than our species has ever experienced. So just a few examples from the last year. In last October, a group of world-renowned scientists published the Lancet Commission on Pollution and Health, in which they essentially estimated that our own wastes distributed through air and water and soil are killing around 9 million people a year. That's 3 times more than all the deaths from AIDS and malaria and tuberculosis combined. A few weeks after that, another study came out of Germany showing that across 63 protected areas in Germany, the total number of flying insects had dropped by 76% in only the past 27 years. A few months after that, a sperm whale washed up on a beach in Spain, and scientists were wondering what could possibly have killed such a magnificent and enormous creature performed an autopsy. And they found that its digestive system was clogged with 64 pounds of plastic garbage. We've learned that 25% of fish coming to market have plastic in their bodies. 92% of the world's seabirds have plastic in their bodies. And so we are in the midst of this moment that Stefan and colleagues have called the Great Acceleration, where our impacts across our natural systems are disrupting those systems at steeper and steeper rates every year. Let me show you what I mean. So these are curves of our consumption, and whether we're looking at appropriation of fresh water or proliferation of motor vehicles or consumption and use of synthetic fertilizers or production of paper or plastics or primary energy use, what you see are very similar patterns with this extremely steep acceleration in our consumption starting around 1950 and continuing through today. And not surprisingly, if you look at similar graphs of our impact across our planet's natural systems, you see very similar patterns, whether you're looking at global biodiversity loss, exploitation of fisheries, atmospheric carbon dioxide, ocean acidification, or loss of tropical and temperate forests. You see, again, this relatively low impact until around 1950, and then this steep acceleration. And this is what Stefan and colleagues mean by the Great Acceleration. So, not surprisingly, this Great Acceleration is leading to what Gus Speth has called the Great Collision between humanity and our planet's natural system. So, fueled by this extraordinarily steep increase in human population and even steeper rise in per capita consumption, the scale of our impacts across all of our natural systems is truly really hard to overstate. So to feed ourselves every year, we appropriate around 40% of the ice-free land surface. For croplands and pasture, we use about half the accessible freshwater on the planet, mostly to irrigate our crops, and we fish 90% of monitored fisheries at or well beyond their maximum sustainable limits. In the process, we've cut down 7 to 11 million square kilometers of forest. We've dammed over 60% of our rivers. Many regions of the world are experiencing growing problems with air, water, and soil pollution. So as a result of this sort of massive disruption across our systems, we're now driving species extinct at about 1,000 times the baseline rate, and the population sizes of mammals, birds, amphibians, reptiles, fishes has fallen by half over the last 45 years. So this is what I mean about this being an unprecedented and unique moment in history. Clearly, these trends can't just continue. But what does it really mean to human health? And so the core premise of planetary health is that the scale of the human enterprise, the scale of it, the size of it around the world, now means that we are exceeding our planet's capacity to absorb our waste or to provide the resources that we need in a sustainable fashion. And as a result, through these increases in human population and per capita consumption, we are fundamentally altering these different dimensions of natural systems. So global pollution, biodiversity loss, changes in biogeochemical cycles like nitrogen, carbon, phosphorus, changes in land use and land cover, scarcity of resources like arable land and fresh water, and disruption of our climate system. And that those different dimensions of environmental change are interacting with each other in complex ways that we're only just starting to understand to alter these sort of proximate conditions for human health and well-being, the quality of the air we breathe, the quality and quantity of food that we produce, our exposure to infectious diseases, our access to fresh water, our exposure to natural hazards. And as a result of this large-scale transformation of these systems, we're impacting every dimension of human health: nutrition, infectious disease, non-communicable disease, mental health, displacement, and conflict. Another way to think about this is that just as we've started to understand, over the last 2 or 3 decades that there are really important social and cultural and political determinants of human health, there are also critical ecological determinants. That indeed our health is nested in a set of environmental conditions, and those conditions are changing rapidly. Let me show you an example. So this is an example of infectious disease. We know that exposure to infectious diseases is driven by this sort of dizzying array of environmental conditions that changes in our climate and temperature, precipitation, and soil moisture affect things like the habitat, the life cycle, the biting rates of really important vectors for vector-borne diseases. We know that from the field of disease ecology, the changes in biodiversity and the composition of species in a system has strong effects on infectious disease exposure, and it appears that, as a rule, reduced biodiversity tends to increase our exposure to many infectious diseases that have been studied. We know that changes in land use, things like dams and irrigation systems and deforestation, affect our exposure to important diseases like malaria and schistosomiasis. So there are numbers of different environmental determinants of infectious diseases. One example I like to use is this example of these farmers up in upland Belize who are just trying to make a living, and as part of trying to improve their livelihoods and improve the amount of food they can produce, they're adding fertilizers to these fields. It turns out that fertilizer goes into waterways and down rivers and gets transported hundreds of miles until it ends up in lowland Belize in these wetland systems, and there the nitrogen and the phosphorus actually trigger a change in the typhal vegetation, the reedy vegetation that you see in this picture, changing it from one type of typhal vegetation to another. That turns out to be better habitat for a different Anopheles mosquito, in this case Anopheles vestipanus, over the pre-existing habitat, which was better for Anopheles albuminus. Well, Anopheles vestipanus is a much more effective malaria vector. And so these farmers in upland Belize who are just trying to improve food production are unwittingly putting their lowland compatriots at much higher risk of malaria through this complex set of ecological changes. And it turns out, although I don't understand why, it's not intuitive to me, But in a meta-analysis of these kinds of nutrient enrichment studies, we see this effect over and over again. So on 6 continents, across 41 pathogens, this kind of increased exposure with nutrient loading was seen 95% of the time. So that's just an example of infectious disease. I want to spend a little bit more time just sharing some of the work that comes from our group. It's obviously not just me, but a whole huge group of colleagues really around the world that I've been working with for over a decade. But I wanted to give you just a few quick snapshots from the sort of research world of what research in planetary health looks like around the nutrition sector. And so I'm going to tell you 3 quick stories that we've been sort of noodling out over the last 10 years. The first is the story of how our carbon dioxide emissions are reducing the nutritional value of the food that everybody in the world is eating. So this was prompted by a set of studies that had been done in the 90s and early 2000s, mostly in chambers and greenhouses in which people were growing crops at elevated carbon dioxide and finding changes in the amount of nutrients in those crops. The literature was somewhat contested for 2 reasons. One was that the experiments were done in these artificial growing conditions, in these chambers and greenhouses, and so some of the plant physiologists thought, this is an artifact of these artificial growing conditions. These are pot effects and weird root effects, and we're not sure we really believe them. The second problem is that they were small, and so they didn't have large enough sample sizes to achieve any kind of statistical significance, and people weren't really sure if they were true. So we put together a group of agronomists all over the world that were growing these food crops, these 6 staple food crops in Australia, Japan, and 2 sites in the United States, using what had become the gold standard, or FACE methodology. So FACE methodology stands for free air carbon dioxide enrichment. And what you see are these rings of carbon dioxide emitting jets. And in the middle of those rings will be a CO2 sensor and a wind direction sensor. And when the carbon dioxide falls below some prescribed level, the upwind jets blow out a little bit more and maintain a constant CO2 level. But in every other way, the crops inside the ring and outside the ring are experiencing identical open field conditions, same weather, same pests, same soil, etc. And so if you grow an identical cultivar of a crop inside and outside the ring, you can isolate the CO2 effect. And so that's what we did, and we grew 41 cultivars of 6 staple food crops over a 10-year period, and on these 3 different continents. And that allowed us to solve both of these problems. One was these were open field conditions, and so we didn't have to worry about artificial growing conditions, and the other was that we had about 10 times more data than all the previously published data combined, so we had the statistical power to resolve the question. And we found that indeed rising carbon dioxide is threatening human nutrition. Overall, we found that staple food crops were showing significant reductions in iron and zinc, that the grains, things like rice and wheat and barley, were showing significant reductions in protein as well, that C4 crops, which is a relatively esoteric group of more drought-resistant crops that includes really only maize, sorghum, and sugarcane as things we eat in some millets, were less affected, and that this was worrisome, because it looks like about 2.75 billion people are receiving at least 70% of their dietary zinc and or iron from the kinds of crops that were losing these nutrients. And we have a baseline of around 2 billion people who already suffer from micronutrient deficiencies at a cost of around 60 million life years lost annually. So the next step was really the sort of so what analysis. So we published this in 2014, but the last few years has been writing a series of papers where we wanted to know, so what? So crops are losing their nutrients. How is that going to affect our health? And if you think about it, the way it affects your health is you're relatively close to a threshold of nutrient sufficiency, and you're getting important amounts of those nutrients from the kinds of crops that are losing them. So how many people fit into that category? Well, there's no way to answer that question without actually modeling what everybody in the world is eating. And so we came right up against that problem early on, because I thought as a physician there's always a table, right? You just look it up. Well, there are no tables of what the world is eating, surprisingly, and so we had to build something called the Global Expanded Nutrient Supply Database, the GENUS database, which we published last year, which estimates the per capita intake for 225 foods for 152 countries, with the nutrient density of every one of those foods across 23 nutrients, and then with imputed age and sex distributions for 23 different categories. So essentially, it is a sort of an atlas of what we think the average, 5-year-old girl in Mali, how many kilograms of bananas is she eating per day? Or the 45-year-old man in Nigeria, how much sorghum is he eating, per capita per day? And so we built that database, and we used it to then model essentially what will happen when the world gets to 550 parts per million CO2, which is what we expect to happen about the middle of this century. And that's where our crops were being grown, at 550 compared to today's ambient levels around 400. So we modeled the diets of 152 countries, and we asked how many people fall into risk of insufficient intake of things like iron and zinc and protein as a result of this CO2 effect. And the first paper we published was in 2015, in which we found that around 150 to 200 million people would be pushed into risk of zinc deficiency as a result of this effect of our carbon dioxide emissions on the food supply. That's in addition to the billion or so people who already have zinc deficiency, whose deficiencies will be exacerbated. And just last August, we published 2 more papers, one on protein and one on iron. The results for protein looked similar, that a lot of people get pushed into risk of protein insufficiency, around 150 million. For iron, it's a more complicated story because it's hard to model iron insufficiency because there's so many things that we do with iron in terms of absorption, and there's so many inhibitors and enablers, and your infectious disease status matters, and so we didn't wade into that very controversial thicket. We just asked, how many people are at high risk? And by high risk, we meant the demographic groups that really suffer from iron deficiency, which is women of childbearing age and children under 5. So how many women and children live in places that already have high rates of anemia, which we took as a proxy for high risk of iron deficiency, and will lose significant amounts of their dietary iron as a result of this effect? And we were surprised that about 60% of the women and children in the world fall into that category. So about 1.4 billion women and children have greater than 20% rates of anemia in the countries that they live in, and will lose more than 3.8% of their dietary iron as a result of this effect. So that was the story with CO2 and nutrients. We did something slightly different but related around pollinators. So this is another story, right, about how we are transforming and disrupting our natural systems. And as many of you know, our pollinators are in decline around the world, bees and other kinds of insects, and to a lesser extent some other animals. And that's a result of a whole bunch of these interacting environmental changes. So climate change, pollution, loss of habitat, loss of forage, land conversion. And we know from previous studies that pollinated crops are responsible for a large share of the calories in our diet, and are also responsible for a large share of the nutrients in our diet. We also had learned in the last big global burden of disease analysis in 2014, I think, that inadequate intake of things like fruits and vegetables and nuts and seeds were causing very large burdens of disease around the world. And so we started to wonder, maybe it's not just about micronutrient deficiency, maybe it's just reduced intake of these whole food commodities that's actually going to be driving burden of disease, and we wanted to look at that. And we did some pilot research in 4 populations around the world that essentially confirmed that really the people at risk were these people who were near thresholds in the case of deficiencies of vitamin A or folate deficiency, and were receiving significant amounts of their vitamin A or folate from pollinator-dependent crops. And so we sort of had a sense of who are we looking for in that area. So we did a big study. We used the same genus database that I mentioned to look at what people are eating and what the nutrient content is. And when we developed these pollinator decline scenarios, we had a database from our ecologist friends that had looked at the pollinator dependence of every single food crop in the world. So we had an estimate of that. And we combined them and essentially looked at 5 health outcomes. So the first 2 were vitamin A and folate deficiency. And we used something called the EAR cut point method, which is the estimated average requirement. It's sort of like a population level RDA. RDA is kind of as an individual. EAR is sort of a population level nutrient requirement. So how many people are falling below the average requirement of those nutrients? That was for those 2 things, folate and vitamin A. And then we looked at health impacts of reduced intake of these 3 food commodities, of fruits, vegetables, and nuts and seeds. And we also were interested in how much of this was in-country pollinator decline versus pollinator decline globally among trade partners. So this is interesting. What we found was that, as usual, being in the global south doesn't look like a great deal with respect to these large-scale environmental changes, and you see this is vitamin A and folate deficiency driving a lot of burden of disease. But what was different, and what was, I think, to me, really interesting, was that when you looked at fruits, vegetables, and nuts and seeds, you saw even bigger burdens of disease in what aren't the sort of global south countries, and in particularly in more developed countries. And the reason for that is that the underlying risk of non-communicable diseases, of heart disease and stroke and a few cancers and diabetes, is much higher, obviously, in the more developed world. And these foods are playing this prophylactic role in helping to prevent those non-communicable diseases. And so the absence of those foods in the diet increases the risk of NCDs, and you see these burdens of disease in a different set of countries. So overall, not to belabor this, around 100 million people getting pushed into vitamin A and folate deficiency, up to 1.4 million excess deaths from total pollinator collapse. That's hopefully not going to happen anytime soon. Where the vulnerability was, and then one other sort of interesting finding was that most of this was from in-country pollinator declines. So this is not, what that means from a policy standpoint is that if you're a country and you want to prevent the public health impacts of pollinator collapse, you actually have a certain amount of control over that. So, the EU just announced last week a much stronger ban on neonicotinoids, a form of pesticide that's been implicated in colony collapse disorder and in pollinator declines. And that probably is quite meaningful in terms of offsetting the public health problems associated with pollinator collapses in Europe. The last piece of work I'll mention more briefly because it's work in progress and we haven't gotten very far yet, but we've for a couple of years been working on global fisheries changes. And so this suite of drivers of ocean warming, ocean acidification, overfishing is changing the population sizes and the distributions of fish all around the world, and we are trying to understand essentially what the human nutritional impacts of those ongoing trends are likely to be. We published a paper last year in which we did sort of our first cut analysis of the total vulnerable population, and we found that around 800 million people in the world are getting really significant shares of iron, zinc, vitamin A, B12 from wild harvested fish, and so would stand to be quite vulnerable to loss of access to wild harvested fish. And over 1 billion people are getting important, over 20% of things like omega-3 fatty acids, and I can't remember 1 or 2 other nutrients. So there's a big population around the world that depends on wild harvested fish for their nutritional sufficiency who are at risk. And so now we're starting to model at the country level what that might mean as these changes take place through our fishery systems, and what are the things that we can do to try to address that through aquaculture and other kinds of policies. So the point here is that, from the standpoint of nutrition, that what I'm talking about, right, is this really little subset around CO2 of all the other kinds of impacts of climate change on quality and quantity of food we can produce. And I've talked about, these two other little pieces of a puzzle, but we're changing everything, right? This is the whole point. We are changing everything at rates that we have never remotely experienced before. And so, there are wildlife declines in bushmeat. We're doing some work in Madagascar that I haven't talked about, looking at that, led by my colleague Chris Golden. Water scarcity and arable land degradation. We've degraded about a third of the arable land on the planet to make it less productive for agriculture. We're running out of water, as you know, in many parts of the world. People are getting displaced at higher rates than ever before, and that causes real issues around food production and nutrition. Pollution, things like ground-level ozone is a potent toxin to many of our crops, and so reduces yields for those crops. And surprises, right? Who would have anticipated 15 years ago that adding carbon dioxide to the atmosphere would make our food less nutritious? And we're going to keep encountering those surprises as we start sort of pushing buttons and turning dials and changing all the environmental conditions on our planet. So it's complex. And if you look at, the rest of the picture, right, nutrition is just one piece of it. But as I said, environmental change is affecting every dimension of health, and so it's also affecting all of these other dimensions, and we could have spent all our time digging down into mental health or NCDs or infectious disease. So I think, as I said at the beginning, that we're only just beginning to come to grips with what a unique moment we are in, and I'm so impressed just from the 10 minutes I've heard about you and your community here in taking that seriously and thinking about how to be thought leaders and work across disciplines to address that. I think it's what we need. I think we need to restructure how we function as universities, that in some ways every single facet of human activity has something to contribute to this issue of planetary health. That, as I say, it's about our food production system, our energy system, our transportation system, the kinds of cities that we design, how we use our land, fisheries management, and on and on and on. And so understanding that complexity, there's no way we're going to come to terms with this moment if we continue to function sort of business as usual. It's going to require new approaches to trading and promoting, and we need new funding streams, obviously, to promote this kind of research. But in Martin Luther King's terms, there is, I think, a fierce urgency to now that we need to recognize. So I, in addition to being a principal research scientist at the School of Public Health at Harvard, I'm also directing something called the Planetary Health Alliance, which you all have joined, which is really, really exciting. We have, I think, about 109 member institutions now in 29 countries, so this is not a Harvard thing. This is sort of a global effort to bring together communities that are committed to working on these issues together. And I invite all of you to join us, not just institutionally, but you can sign up for newsletters and sort of stay in touch with what we're doing. We're having our second big annual meeting in the University of Edinburgh at the end of this this month now. It's May 1st, the end of this month. So with that, I'll close and take questions. Thank you.
Well, thanks very much for your remarks and your work. This is very good to see. I had a couple of things. As we look at these influences, at what point or what are projections for declines in human population, or at least the growth rate of human populations? Do you have figures on that or something?
Do you mean as a result of the environmental changes I'm talking about, or just the natural trend in human population growth?
Well, I'm thinking as a result of this degradation of our environment.
We don't have any kind of trends for that, and it's actually quite fascinating. I'm in the middle of I won't say conflict, but a conversation with a group of authors about a paper that I've been on that's trying to integrate, and I will get to your question, but I'm trying to integrate our CO2 crop data into models of global food production going into the future, the impact model that the International Food Policy Research Institute puts out, and all of these projections about how are we doing in terms of feeding the global population. And so I've been working with them because it's our data they're incorporating, and but then the manuscript came out, and it does what they tend to do, which is to look at the past trends of economic growth and project them forward into the future. And so the nutritional projections are that people are going to get better and better fed over the next 50 years, and nutrition is going to steadily improve. And that is an honest linear projection of past trends. And that, they're going to be, there's going to be this sort of incremental drag because our food's getting a little less nutritious. And I've basically said, look, I'm uncomfortable that's fine if that's what you want to say, but I'm not going to be on a paper that says that, things are getting better and better in terms of nutrition, because I think saying that the past is prologue, saying that we can project these linear trends forward, doesn't acknowledge the moment that we're in, and that, we're actually, in fact, most of the things that we did in the Green Revolution over the last 40 years have kind of gotten about as far as they can go in most parts of the world, and on top of that, we're running out of fresh water, and our arable land's being degraded, and we're bumping into climate change, and our food's getting less nutritious. And so you can't ignore all of that and just project these trends forward. But a lot of that's kind of the state of a lot of these sort of UN level global projections. So there's nobody saying, here goes population bending as a result of these environmental changes. And I don't know how one would do that. What I can say is that if you ignore the threats that I've just been talking about, we still see human population bending. And so the projections now are that, human population stabilizes around the end of the century, and there's a lot of variance, but somewhere between 10 and 13 billion people, which is a lot of people. And if we could make it 10 and not 13, not because everybody dies miserable deaths because of starvation, but because women have access to family planning and girls are getting educated and women have economic opportunities, that would be a better world, in my opinion, to live in. But it's hard to say exactly what the impacts of these trends will be on the population right now.
That tells me that denial is alive and well, and thank goodness for that.
Change is slow, right? Change, incorporating this kind of thinking is slow, and it's why what you all are doing, trying to cut across these disciplines and integrate, is so important. Yeah.
I think you're one of the first few speakers that has not ended with a message of hope. And I think as professionals in our field here, we don't necessarily have to hear that message. We know how urgent it is. I think it spurs us all to work even harder. But the rest of the community, I wonder if they needed to hear a message of hope, because some say that feeling hopeless spurs inaction and paralyzes people.
Sure. No, I've been struggling with that. I mean, there is a wide-held belief, and I don't know how true it is, that all of our talks about climate change and planetary health need to end on a hopeful note, because otherwise people are mired in despair and apathy, and they don't do anything. I don't know that I quite believe it, and I do actually have things that I'm very hopeful about, and I can speak about them. I've been doing a really interesting project this fall for me. It's been a real education. We've had Terry Tempest Williams, who's a lovely writer and thinker on many of these kinds of issues, and she's been at Harvard as a writer in residence at the Divinity School, and she and I have been working together, and we started a little series called the Constellation Project, and we have been talking a little bit about grief. And we showed a film, I don't know if any of you have seen this film, Albatross, but it's an absolutely beautiful film. It just came out for the public just only a couple of weeks ago, and I could not recommend it more highly. And we screened it in our largest auditorium at Harvard a couple of months ago as a sort of first event, and we had Chris Jordan, who produced it, filmed it, come and speak, and we had a panel. And it was an unusual panel, for Harvard anyway, in that we had a professor from the Divinity School, Chris Jordan, Terry Tempest Williams, Jim McCarthy, who's a marine scientist who ran the AAAS and led one of the IPCC assessments, and I as panelists talking about it, and it was about grief. And it was about, we had a hopeful event around, this is about plastic in the oceans, and we had a hopeful event a day later. We didn't want to transition to hope. And the film doesn't transition to hope. There's not a single damn hopeful thing in that whole movie. It crushes you. But it's so powerful, and it's so beautiful. And what it does is to celebrate our emotional and spiritual connection to the natural world. And there's a way in which I think that is sort of the elephant in the room. That most of us feel some kind of emotional, spiritual connection to nature. And that we tend to deny that connection any authority in the conversation we have as professionals and scientists. And I don't quite know how we've gotten there, and I think it may be actually something that's sort of foundational in causing the problem that we're in the first place. And Chris Jordan in his film says, grief is the other side of love. And that it's hard to honor love or reverence or awe or whatever words we want to bring to the relationship that we have with nature without acknowledging grief at what's happening to so many of these systems. And so there's a sort of facilness to me in talks that lay out 45 minutes worth of, boy, is this problematic to continue the trajectory we're on, and then end with the sort of 5-minute Band-Aid, but hey, it's going to be great. And so, I don't know. I mean, it may be a mistake that I'm not doing that, or maybe that it's audience specific, and I need to figure that out myself, and certainly I do think there's a vision for what the future could look like in 100 years. It's a very, very positive vision. And I think that this is an inflection point. It's part of what's so interesting about this moment that we're in, that we have to make decisions about which trajectory we're going to be on. And it's kind of up to us, which is why the kind of leadership that you all are already showing is so important. But yeah, I don't know the answer. Yeah.
So building on that comment, I'm really interested in the whole notion of foresight, and obviously you're a man with foresight into the future. Can you share with us when you had your foresight epiphany, and how might you influence foresight epiphanies in other people?
I'm not a prophet, and I don't think I have any more foresight than anybody else. I think that this is really about understanding, and as I say, I think we are only just beginning to understand the moment that we're in, and I feel that on a daily basis. So this is, stuff that's been unfolding for me all fall and winter long. I mean, I read that story about the sperm whale in the New York Times, I don't know, 2 weeks ago or something, and I was on my way to go running, and it made me sort of want to weep, but just because it was a symbol of how profoundly we're changing our world, and then it made me think, nobody understands this. When we look at those sort of exponential graphs, we can't catch up to the moment that we're in. When I was born in 1965, this wasn't a set of problems. And I'm not that old. So we haven't caught up to it yet. And so I think that to the extent that we can develop foresight, it starts with understanding. And I think what we really need to do is just understand the present. We need to understand the moment that we're in and the implications of the decisions that we're making and that fierce urgency of now. Why what we do right now is so important. And it sounds like this is a community that already gets that, but it's unusual. So, yeah.
Sam, thank you for your comments. As I listen to you, I have 3 comments. The first one is that it seems that perhaps the most core calling for all of us is fostering the transcendence from linear thinking to the fullness of interrelationship. Second, when you were just making the comment about our sense of who we are, there's an interesting coalescence here of publicly acknowledging and welcoming love, gratitude, how it is that we work together, including spirituality, within a public university. And so when you shared Albatross, etc., although we might be small, the community here, including our School of Nursing and our interprofessional colleagues, is deeply committed to being an edgy, transformative partner in what you're saying. Here's my question. If we focus on the United States and we focus on the tremendous resources that are being pumped into precision medicine, precision health, what I hear you sharing is actually, that's not upstream either.
Yes.
When you think of the genetics and epigenetics, it's just another part of, frankly, not being that boldly effective in being able to impact a number of disease situations, including cardiovascular, neuro, and cancer, etc. Would you comment on our investment in our policy?
Well, first of all, thank you for being partners with us in this. It's a real boost to hear that. I think that you're right. I mean, I think that personalized medicine. I mean, there's this divide, right, between clinical medicine and clinical research and public health. It's always been there, and it's always been odd that such an unbelievable majority of spending goes into things that don't actually improve population health remotely as effectively as the things that we already know about that would be so much less expensive to do. I mean, why are half the babies in the world born to women who would like to have access to family planning but don't? I mean, just these basic things that are so straightforward, sanitation and hygiene, et cetera, et cetera. So to me, this is sort of part of the same thing, that we put an awful lot of money into sort of very high-tech biomolecular medicine, and I think comes partly out of the siloing that you're saying that you want to break down. I mean, that if all of your world is inside a box and the changing environmental conditions are outside of that box, it doesn't matter how loudly we lay this out or how strong these effects are, they're invisible. And so you got to get out of that box. And but I agree. I mean, I think this is, you need a revolution in how we think about protecting health and the rest of the biosphere all together. And it's, I guess what this whole conference is about that's happening across the street. But I agree with you. Yeah. I'll go the way.
I'd like to ask a more local question in your experience. At Harvard, they started to teach in its medical and other professional curricula on global change, probably in the mid-1990s. And we started about the same period in Nebraska. I moved here from Nebraska recently. And of course, things have not sped up. They're going pretty slowly. But I'm wondering what's happened. We're trying to build some climate issues into our first-year medical school. I don't know what's happened. You're doing in nursing school, but you could tell us about it. But I know you're focusing on interprofessional training. But we're thinking not so much of the advanced study graduate students in research, but what are you doing with the beginning practitioners in the various health professions programs? How's it going? How are they taking it? How much interest is there? What's happening there in Boston?
Yeah, so great question. Short answer, I'm not really doing that.
But what are your friends doing?
Yeah, the School of Public Health, which is where my appointment is a very different place culturally in terms of what we focus on in the medical school. There have been classes available to the medical students, as you say, that focus on some of these issues. And I haven't been very involved in that. We have started to try to build expertise at the School of Public Health in this. And even that, I've been slightly peripheral because I've been coming out of the Harvard University Center for the Environment, which is a university-wide environment initiative. And I need to work closely with colleagues in the Faculty of Arts and Sciences, the natural scientists, the ecologists, the climate scientists, et cetera, et cetera. But now we've started to move into what can we do to build, and there's a new sustainability MPH at the School of Public Health. We're starting to hire faculty in planetary health and doing more teaching. I'm also right now teaching undergraduates about planetary health.
Are you then in this larger sphere, and I think we're struggling here at a similar large university with many academic dimensions, to bring things together because they have to be brought together. How about the greening side of Harvard, the sustainability of its energy practices, toxics, waste, and so on? Are you trying to integrate with that, or is that happening somewhere else?
That's pretty much happening somewhere else, and I'm not sure that the planetary health angle becomes critical to how they go about their sort of greening of the Harvard campus effort. But let me speak to the larger issue that you're raising, because I think it's relevant to everybody here and really interesting, and Teddy and I were talking about this earlier, which is sort of what's the role of somebody being trained in the clinical health sciences around these issues. And so I want to flip it around. And
that's very much the question I'm trying to
and I think it's a really important question. I get asked it a lot as somebody who's a practicing internist until a few years ago. What do we do at the medical school, the School of Nursing, across the board? And at first I was sort of stymied by that question because I do see these as population health issues. And so if your focus is on the individual who is sick in the United States, how does understanding that, deforestation is causing malaria in East Africa, how does that help you? And but I think there are a few ways that are really important that we were talking about. One is that there are a set of lifestyle decisions that, I just got something from the Harvard Gazette this morning saying that they just published a study showing that 5 lifestyle modifications add 10 years on average to your life, and I forget what they were. It was exercise and not being obese and not smoking and eating a healthy diet and one other thing. It wasn't sleeping, but that's a good one. That might give you another couple of years. But I think that this idea that there are things that we should be teaching our patients that are good for them in terms of individual health, but they're also central to getting on this new trajectory that I'm talking about. And those are things like, muscle-powered locomotion, walking and biking to work, eating a more vegetable source diet and eating a lot less red meat. And there are sort of a host of of interventions or lifestyle changes that make sense from both perspectives that we could all in the world of clinicians be promoting. I also think that we touch more than almost any profession people across every dimension of the political spectrum on a daily basis, and we have enormous authority. Teddy was sharing with me that nurses have the greatest authority of any profession in this country, and physicians are below them, but they're still, at least by most people, respected. So we could be using that authority to share this message better, and I'm really interested in how groups like the College of Lifestyle Medicine and groups like yours and sort of motivated clinicians groups could start to co-create pamphlets that are in medical offices and curriculum for clinician training, and sort of integrate some of this understanding with these connections of what's good for you and good for future generations and displaced generations and the rest of the planet. What are those sort of steps that are, make a lot of sense from any perspective, like eating less red meat, for example. So I think there are things that we could do, and I think we haven't had the bandwidth to lead that in the Planetary Health Alliance.
I appreciate that. I'm just curious what you're learning about these things. Can I ask you about Boston?
I'm going to actually close if I can,
Okay.
because we'll have some time afterwards.
All right.
I want to be respectful of Dr. Meyer's time. He's been very gracious to take an hour of his conference time to come over across the street to speak to all of you. So we are so grateful you are here to give us a vision of what's possible, and know that we are your bold north. We are dedicated and committed to planetary health. Thank you so much. Lovely coffee and fruit and scones, so please help yourselves, meet each other, because we are going to be creating solutions across sector. That's how things are going to get done. Thank you all for being here.
Your weekly planner right out here.
Yep.
You do it in a different way.